Today we are going to be discussing how to prepare and inject your insulin using an insulin vial and a syringe. It is important to keep your insulin vial in the fridge until you need it to ensure the insulin works to the best of its ability. The vial that you are currently using does not need to stay in the fridge. It may stay on the counter or be carried in your purse. However, it is important to keep your insulin out of very hot or cold environments like in your car. Injecting very cold insulin may cause increased irritation. To safely inject your insulin, you will need a new syringe, your insulin vial, and an alcohol swab, only if you have some available. Before starting, wash your hands in warm, soapy water. If you are using a cloudy insulin like NPH, roll the insulin bottle between your hands to mix until the insulin is uniformly cloudy. Clean the rubber stopper of your insulin bottle with an alcohol wipe. Remove the cap from the syringe stopper and from the top of the syringe. Save the cap for the needle to recap the syringe once your injection is complete. Fill the syringe with air equal to the number of units of insulin that you will be taking. Insert the syringe needle into the rubber stopper at the top of the insulin vial. Push the stopper all the way in until all of the air is injected into the insulin bottle. Keep the syringe in the bottle and turn both upside down. Draw out your dose of insulin into the syringe. The top part of the stopper should be in line with the number of units that you are injecting. Gently wipe an area of skin with an alcohol swab or just make sure that it is clean in order to prevent any infection. Insulin should be injected into an area of fat tissue. Many patients choose to inject their insulin in their stomach, but you may also use a non-muscular area on your thigh or on the back of your arm. The important thing is to ensure you are rotating the site with each injection. For example, if you inject on the right side one day, inject on the left side the next day. Avoid areas within 2 inches of your belly button. Once your syringe is ready, you are ready for your injection. The angle at which you need to insert your syringe into your skin depends on the size of your needle. Consult your pharmacist or provider for specific instructions. You will likely not feel the small needle entering your skin. Once the needle is in the skin, press the plunger on the end of the syringe and you will see the insulin in the syringe decrease. Keep pressing until the plunger reaches the top. Count for 10 seconds before removing the syringe from the skin. Do not massage the skin once you take out the needle. After you are finished, recap the syringe with the cap you saved from earlier. Once capped, discard the syringe in a puncture-free container, such as an old laundry detergent container, a coffee can, or a Sharps container. You can purchase a Sharps container online or at a pharmacy. Once these containers are full, you can tape them up and put them in your trash. Do not use a syringe more than once, as this can increase your risk of infection. You have now safely administered your insulin. Be sure to ask your medical team about any questions that you may have.